Hello everyone. Today we are going to discuss about how to manage pain and how to assess pain, different types of pain, and simply what is pain in general. So I love putting everything of mine in my notebook here, in my phone notebook. So I do enough research that I know it will help you out there, and this video can be of hope. So simply today we are going to share about pain. So pain is the most common symptom of a disease, or it is a symptom underlying a disease. It is unpleasant sensation localized to a part of a body, say on your limb, in your abdominal region, any part of your body. So it's often described in terms of penetrating or tissue destructive processes, e.g. stabbing, burning, twisting, tearing, squeezing, or of a bodily or emotional reactions, e.g. terrifying reactions, nauseating reactions, sickening, and any pain of moderate or high intensity is accompanied by anxiety and the urge to escape or terminate the feeling. So simply, if you get anxiety, sickening, nauseating, terrifying pain, it's just the form of the body trying to escape or terminate that feeling. So diagnosis of pain in diagnosis of pain, if you receive a patient or you a person, you start feeling like you have pain, the most diagnosis of pain is self-report, which is so much the key to the pain assessment. If you're assessing pain, you clearly have to talk to your patient. Let the patient tell you which specific part he or she is feeling pain from, say like on his right limb, lower abdomen, specifically where the patient tells you he or she is getting pain from or feeling the pain from. In non or preverbal children, say like the children who cannot talk, who are still young, the infants, the facial expression is the most valid indicator of pain. How they express their faces is the valid indicator of the pain. Therefore, use faces pain scale to assess severity. Use different faces scale to assess the severity, which can be assessed by duration, how long it takes, the severity, does the patient wake up because of the pain, the side, is it on the upper limb or is it on the lower limbs. So you identify the side, the character, e.g. stabbing pain, throbbing pain, or Cushing cramp-like pain, the persistent or intermittent, the relieving or aggravating factors. All those kind of factors you can easily use in a pain scale for assessing so much in children who cannot talk, who cannot explain which specific body part are they feeling getting pain from. So in children, pain can be assessed by child's crying voices, posture, movement, and color. You identify how the baby or how the child is posturing his or herself. Does the baby only posture on the right side? When you change the baby to sleep on the prone, maybe on his back, does he feel pain? If you try to move his limbs like his legs, does he feel pain? So you can simply identify the pain assessment in children through that. So the treatment for acute and mild pain, most commonly people and pharmacists and doctors use aspirin, paracetamol, non-steroid anti-inflammatory agents, the NSAIDs. These drugs are considered together because they are used for similar problems and they have similar mechanisms of actions. So the mode of actions are almost similar if you get the NSAID, the paracetamol, and the aspirin. Now here we can use A class, like acetylsalicylic acid, 600 milligrams every 4 hours until pain subsides, or you can use paracetamol 500 to 100 milligrams every 6 to 8 hours until pain subsides. Children, you use paracetamol 15 milligrams per kg dose, which can be for 4 to 6 hours when required to maximum. And as we are still talking about pain, I want to show you how to deal with the treatment of severe pain. So in my previous video, you can identify that we have just a mild and moderate pain that you can use aspirin, you can use paracetamol, and you can use an NSAID. So the NSAID you can use all have the same modes of action. So now the treatment for severe pain, you use opioids, the most potent pain relieving drugs currently available. They have the broadest range of efficacy, providing the most reliable and effective methods for rapid pain relief. Those are the opioids. So others, you can use tramadol tablets or injections 50 to 100 milligrams every 6 hours until pain is controlled. Morphine, you can use 100 milligrams IV, the intravenous injection every 6 hours on when necessary basis. Children, 0 to 2 milligrams per kg bodily weight IV, which is intravenous injections or fluids being put and every 6 hours. For surgery and obstetric conditions, like if a lady has been in obstetric, like you use phenitidine, which is 100 milligrams IM intramuscular injection, and every 6 hours when necessary. Caution: you can use only opioids. Opioids may cause respiratory depression, therefore use opioids carefully in case of toxicity. Reverse the narcotoxicity and antagonistic naloxone. So what if you can use the NSAID, you can use the aspirin, you can use the paracetamol, you can use the morphine, you can use the tramadol. All that can deal with pain. The NSAID I'm trying to mean, you can use maybe ibuprofen, which are parts of the NSAID. So if you're using the opioids, which include the morphine and the tramadol, you simply have to know the caution of it causing the respiratory depression, and therefore use opioid carefully because of its toxicity. So the antagonistic naloxones can be used like 0.1 to 0.2 milligrams IV intramedically, maximally 10 milligrams. Do not administer morphine. Morphine is never administered in advanced liver disease. If a patient has advanced liver disease, severe head injury, you don't need to give morphine. Acute asthma, you don't need to give morphine. Advanced chronic obstructive bronchitis, you don't need to give morphine. Respiratory disease with imminent respiratory failure, you don't need to give morphine. And treated hypothyroidism, use morphine with extreme care if there is recent or concurrent alcohol intake or CNS depression, hypovolemia, shock in the elderly. And simply, as I'm trying to bring about the conclusion of how to manage the moderate, mild, and severe pain, if things worsen, do the referral. Refer to the regional or tertiary care for all children with moderate or acute severe pain. No response to oral pain control, unable initiate opioid therapy. And